All right, this is our second patient, Paul. You all probably know him by facial. He's got a very bad back. He's in for a functional capacity evaluation to get total disability as an attorney. So Paul hurt himself weightlifting a few weeks ago. So we're going to just check him out here for some tests to see how legitimate his complaints of back pain are. So the first test, Paul, I'm just going to press on your head like this. And
that hurts.
That really hurts.
That hurts.
Okay. So you see there's a positive response like that you can see. Yeah. You okay? Yeah. Okay.
My attorney O'Kander told me that this was going to be difficult, but I'll be okay. I'll be okay.
Yeah. He probably told you to try your hardest too.
He did.
Yeah.
He did.
Yeah. Okay. Now I'm going to put your hands on your hips, and next I'm going to just twist you gently to the right. Yeah. Okay. All right.
That's about as far as I can go.
Okay.
That's about as far as I can go.
Okay, and then this way to the left. How far can you go this way?
It's bad, but not as bad as the other one, but still pretty bad.
Okay, and where do you feel that pain at? Do you feel that?
You know, all through my back and down through my legs, and there's
okay.
some kind of up my
Up
shoulder-ish.
And you can see on both these tests, when we do the cervical compression, there's no pressure at all in the lower back. That's a positive response. And we can see here with Paul, when he turned, I'm not saying he's faking his injuries, but there's some cause of suspicion right now after these first two tests, okay? So next, I'm going to put him on the table and ask him to sit here, and I'm going to check his reflexes, okay? Oh, actually, could you just sit up over the side for me first?
Yeah. That's hard.
Yeah.
You're watching this, aren't you?
Yeah,
Okay.
I am. Yeah, thank you. So first test I'm going to do is just his reflexes. If you could take your hands like this and pull for me like that, yeah. And we'll just see how that looks. And we see here he's got...
That one hurts really bad when you do that.
Okay. Yeah, that's... Yeah, and we can see these are pretty hyper-reflexive reflexes. Now, if you would you please straighten this leg out for me? Just as straight as you can. Yeah. Yeah, I'm just going to check the strength in your foot, if you don't mind. Hold that. Okay, good. And the same thing here. Let's just check this out. Go ahead and straighten this out for me. And we'll get that thing straight. And we see this angle is about 90 degrees, which is what we want to pay attention to. Okay, great. Now next, can you lay down on your back?
Yeah.
Thanks.
It's going to take me a while.
That's okay.
I one time took a deposition at Todd Bennett's office where I had to lay on my back during the entire deposition because of the back pain. It was amazing.
Yeah. Okay, so next, as you can see here, we did that straight leg raising and he had 90-degree angle. Now here we're going to raise it up and see how far it goes. And how far can it go, right?
That's about it.
Okay, so we see here that is greater than 40 degrees different, and so that would be a positive test. And we'll see on the other side. And we've got some shaking going on and things that way. So that again would be a positive test. Much positive, greater than 40 degrees. So that he's positive on one, the compression, positive on rotation. Next we're going to go ahead and check his strength. And we know from earlier that if he does have this pinched nerve that he claims he has, he should have a specific weakness. And if it's the S1 nerve root or the L5 or the L4 or the L3, we can go ahead and don't fight me. There we go. So the first test we're going to do is basically this. We're going to bring his feet up and just have him dorsiflex his feet up like this. And we're going to test L4. And that's the anterior tib. And he says he just kind of gives out on that. And does that hurt or is that just weak?
It's like I felt something pop in my back when you did that.
Okay. And then your big toes, raise those up. This is L5, the extensor hallucis longus. And we do this, and that gives out too. It's a very good example of giving away weakness. The next is eversion, his fibularis muscles, and as he takes this out and everts his foot, I resist, and there's just not much.
That's almost too much.
Yeah, okay. And then we'll try to get S1 here. We'll turn his foot in eversion, and you can see here again, giving away weakness all the way around. So very rarely would you have a client have a L4, L5, and S1 weakness all the time with one lesion. Then we can go up further, and I'll have him bend his knee up. And I'm going to resist him here to check L3, and that's his hip flexor, and I'll pull this, and you can see again a consistent example of giving away weakness, an excellent example of giving away weakness, I might say. Finally, we'll check his sensation also. And so with sensation, L3 is up the top of the thigh. Can you feel this at all?
What are we talking about here?
Do you feel my hand at all or not?
No, where do you have it?
Okay, and then here?
Just a little bit down by my foot.
Okay, all right. And then how about out here? Can you feel this?
No.
No,
No.
okay, nothing, right?
Maybe some burning. but
Okay, and how about on the inside?
A little bit. Feels kind of nice. But
Okay, all right. Now I'm going to check, again, on the dermatomes, which are the specific nerves. On the inside is L4. Can you feel that at all, Paul?
a little on the right, not on the left.
Okay. And then on top?
Not really.
Okay, and then how about on the outside?
No?
No, it just is reflexive for
Yeah.
you there, okay? So we can see there that he's got all these dermatomes affected, and that would be another positive response. Next, if you could turn towards the camera, okay, and just turn on your side. Yeah, good.
Oh, God.
Now, the last test is palpation. I'm going to lift this up, and I'm going to touch him first on the sacrum. When we touch that, there are no nerve endings on the sacrum, so this should not be tender. Do you feel that at all?
Sacrum? Damn near killed him. That hurt so bad.
Okay. And then, of course, then I would do light palpation all the way around his back and see if there's any positive response to that.
The whole thing just hurts.
Yeah, okay.
Did they
So-
pay you to try and hurt people in here? Or?
Yes, they do pay us for this test. So, next, we're going to go ahead and have him sit up again. And those are example of all the Waddell's tests. The final one would be overreaction. And we saw overreaction on every one of the tests, both by facial expressions and facial grimaces of pain out of proportion to movement patterns. We saw how he jumped up on the treatment table first, but then when he was asked to get up and down when someone was watching, there was an inconsistency in